They try and create lies about vaccines that they're not as tested as pharmaceuticals. Lie. It's the exact opposite. The first vaccine, smallpox, 1700s. We've been doing this for centuries, protecting people in order to prevent them getting illness. In fact, some of the community that is anti-vaccine a lot of times criticizes our healthcare system for being too reactive and not proactive, not preventing illness. And I agree, we do need to do a better job there. But vaccines are an example of prevention. They talk about pharmaceutical companies making money off these medications. Well, when you get a vaccine, you don't need treatments because you won't get sick with those illnesses. And the scariest and most sad part is the victims of this are going to be kids. I have no doubt in my mind that this year, children will die unnecessarily from vaccine preventable illnesses like measles. It's a guarantee. And why those children need to die, I don't have an answer for. These people who are proponents of anti-vaccine rhetoric, they used to say that it was thimerosal, a mercury component of vaccines, that was driving the autism epidemic, why autism rates were going up. That was a claim they made. We've eliminated thimerosal in childhood vaccines. Autism's still going up. All their claims that they made are untrue, but now they move the goalposts to another thing.
Where do you fall on this, Dr. Mike, when it comes to all of the claims all over the internet and autism and vaccines that prevent children from dying of preventable diseases?
Well, we need to be honest. Autism rates are going up.
Mm-hmm.
We don't have a clear answer. This is where we had a red flag, and we need to not wave it when the medical community says we don't know. We need to understand that we're seeking the answers. But Mel, the way we get answers in science is not by just saying, oh, the expert said this, so we will agree with them. It's by testing different theories, constantly being self-critical, constantly putting forth a hypothesis and ruthlessly testing it over and over again, trying to disprove our own theories. But in this day and age of social media, people want to put out a theory and find evidence to support their theory, which is not how good science is done. Good science tries to put out theories and adequately challenge them over and over again. And the more you fail in challenging your own theory, that's when you usually have a good theory. And we're losing sight of that.